This is one of the most underlooked at areas when we're talking about a stiff ankle or stiff foot or lower extremity issues. It's called the posterior tibialis muscle and the flexor hallucis longus muscle. Now we're working on both of them at the same time because they're right beside each other, and realistically to kind of get in there and specifically work on one or the other is pretty tough. Besides, what we want to do is make sure both of them are moving rather than just one. So where these muscles kind of live is they live on the inside edge of the tibia. So the tibia is that big shin bone that we have. Over here where I'm kind of pointing is where it gets kind of flat. And then over here, it kind of drops off a ledge. And that ledge, and right behind that ledge, against the tibia is where those kind of live. So what you'll do when you're assessing this area is you'll run up and down, and obviously we're going to be assessing for tenderness, but remember, tenderness isn't ideal when it comes to if it's the only thing you're looking at. We also want to make sure we're looking at this person's midfoot mobility to see if they need it. We're looking at their toe extension in neutral versus their toe extension in dorsiflexion to see if that has some tightness. Tenderness in itself isn't going to be the exact thing we want to work on, but it can give us some clues. So we work up and down that area. Now, what we'll see a lot of times with these folks that have midfoot mobility problems, as you work up and down there, you'll find some kind of tender spots, but those areas are generally where we'll want to hang out as long as this person has other impairments as well. Now, if you want to selectively work on the flexor hallucis longus, the easiest way to do it is after you pin that spot down, you want to extend the toe and dorsiflex the ankle, and you should be able to feel some tautness underneath your thumb of that muscle kind of getting a little tighter, and that allows us to kind of chase a little more length with that muscle. Now remember, when we're doing soft tissue techniques, any changes we get are neurophysiological in nature, meaning that we want to make sure the patient's comfortable. We want to make sure that we're not sitting here telling them bad narratives like, hey, you need this, I'm breaking down scar tissue. None of that is happening. We're just targeting an area that can cause symptoms down at the ankle and foot and some stiffness, and we want to make sure we load it up after. So when you do this, make sure you're targeting these areas properly, and you'll see a lot of cool changes.